Hello. For those of you who don't know me, my name is David Zapala, and I'm running for president of the American Academy of Audiology. I've been an audiologist for over 40 years, the last 20 of which I've worked at the Mayo Clinic in Florida. Over that time, my concept of what an audiologist is has changed. I believe that we help people with chronic conditions related to the ear and hearing cope and ultimately live a fulfilling life. We understand hearing from an ecological perspective. We characterize a person's receptive auditory abilities. We listen to their lived experiences with hearing loss. We help them understand why they are having hearing difficulties, and we work collaboratively to develop a plan to address their unique challenges and desires. Notice, I don't mention hearing aids. I don't mention hearing tests. Over the past 20 years, I calculated that I performed over 25,000 audiological evaluations at the Mayo Clinic. Each evaluation included a pre-appointment chart and questionnaire review, case history interviews, physical exams, a formulation of my clinical impressions, a collaborative development of a plan of care for the patient. I've made referrals, communicated with other providers, and documented my results. All of these are evaluation and management activities where I had the greatest impact on my patients' lives. They are also completely unrecognized and unreimbursed by our healthcare system. When I tally the total hours I've spent giving away E&M services, it comes to over 8 years of my 20-year career at Mayo Clinic. And as I say this, I recognize that I am lucky to have had a position where E&M services were expected of me. Our current healthcare system is intentionally designed to restrict audiologists to be test technicians under the control of physicians. But that is not who we are. We live under a repressive system that has consequences. Obviously, we're not paid for what we do. The development of our profession has been stunted. Our research has suffered from a lack of qualified PhDs. Professions that are valued and are well funded do not have these kinds of obstacles. Audiologists will not be valued if all they do is provide hearing tests and are perceived to sell hearing aids. That is why the Academy's Medicare Audiology Access Improvement Act is such a game changer. It recognizes audiologists as providers of care and not just technicians. The Academy is many things, but at its root, founding vision of the Academy was that audiologists were independent healthcare providers. The Medicare Audiology Access Improvement Act is an important step forward toward achieving that vision. As president, I would make it my highest priority to rally for the passage of this act. I would also continue to push for recognition of evaluation and management services provided by audiologists. It's good for the profession, but it's vitally important for the people that we serve. Best wishes.